Hi, Dr. Bernardo from New Jersey Plastic Surgery. Hi, Dr. Bernardo at New Jersey Plastic Surgery in Montclair, New Jersey. Today we're going to talk about your choices of breast implants. We do this as part of our educational series to help patients look into all the options, whether they're breast implants, injectables, lasers, and we want to keep you informed and up to date. So I have some implants here, and we're going to go through them historically. First of all, we have saline implants. Saline implants we had used for many years, and they come empty and they're filled with saline, so liquid, and this is what they look like. They feel, obviously you can't feel them watching this, but you can see that they're more like a water balloon, not as much substance inside. But the nice thing about them is if they leak or rupture, which is rare, but it could happen, saline, which is part of your body, would leak out and you'd notice it right away. Easy to know there's a rupture. So the next type implant is the silicone gel implant. Now, silicone gel implants were available even way before the salines, but they were more of a liquid, and they had certain problems, and the new type of gel implant is called a cohesive gel. And you can't appreciate this, but by me squeezing it, it feels more natural, it feels more like a breast. And this is actually a solid. If you cut it in half, it would not leak out. It's called cohesive gel. So although that feels very natural, if this did have a rupture of the wall, you would not be able to know there is a leak because it doesn't lose volume. It sits there. You're supposed to get MRIs every few years to detect if you have what's called a silent rupture. Now, there are going to be some new technologies going forward that we'll show you in the next episode, where we'll have ultrasound units that we can do in the office to look at the front and back wall of these implants to detect if there's a silent rupture without going for an MRI. So now let's talk about a new implant, and it's actually a new category. So we have saline, we have gel, and this is called a structured implant. Structured because when I squeeze it, and again, you can't feel this, but it feels more like a gel, but it's filled with saline. Why does it feel more like a gel? Because it has chambers and baffles, and it has structure to it. It has structure that holds it up, it gives it form, and that also gives it the ability to have very good statistics against some of the problems like capsule formation, hardness around an implant. But when it comes to rupture, any of these could get a rupture. It's rare, but these would lose their volume, but they're like a saline. They don't need to be monitored with the MRIs because it's still a saline implant. So the conclusion is saline implants, cohesive gel implants, structured saline implants. These are becoming more popular because they have the feel of a gel, but the safety profile of a saline. So these are all options. When we meet with you as a patient, we go through all options as we customize all procedures for you, and we welcome you to come in for consultation. This is Dr. Bernardo at New Jersey Plastic Surgery. Thank you for watching.